Pap smears are an important part of women's health, and understanding what to expect can help ease any anxiety or uncertainty you may feel about the process. Whether this is your first time or you're simply looking for more information, knowing the steps involved, why it's done, and how to prepare can make the experience smoother and more comfortable. A Pap smear, sometimes called a Pap test, is a simple screening procedure used to detect changes in the cells of the cervix, the lower narrow end of the uterus that opens into the vagina. The primary goal of this test is to identify abnormal cervical cells that could potentially lead to cervical cancer if left untreated. Early detection allows for timely intervention, greatly reducing the risks of serious health issues. Most healthcare providers recommend that women begin Pap smear screenings at the age of 21, regardless of when they become sexually active. After your first test, how often you need a Pap smear depends on your age, health history, and the results of previous tests. For many women, a Pap smear is recommended every 3 years, but your healthcare provider may suggest a different schedule based on your individual needs. Before your appointment, there are a few things you can do to prepare. Try to schedule your Pap smear for a time when you're not menstruating, as heavy bleeding can affect the accuracy of the results. Avoid using tampons, vaginal creams, suppositories, or douches for at least 48 hours before the test. These products can wash away or obscure abnormal cells, making it more difficult for your provider to get an accurate sample. If you have any questions or concerns, don't hesitate to contact your healthcare provider ahead of time. On the day of your appointment, you may feel a mix of emotions: nervous, uncertain, maybe a bit embarrassed. These feelings are completely normal. Remember, your provider is a professional who performs Pap smears regularly and is committed to making you feel as comfortable as possible. When you arrive at the clinic or doctor's office, you'll be asked to check in and provide some basic information about your medical history. You may also be asked about your menstrual cycle, sexual activity, and any symptoms you've been experiencing, such as unusual bleeding or discharge. This information helps your provider tailor the exam to your needs. Once you're called back to the exam room, you'll be given a private space to change into a gown or drape. You'll be asked to remove your clothing from the waist down, but you'll be provided with a sheet or gown for coverage. When you're ready, your provider will return and guide you through the next steps. You'll be asked to lie down on an exam table, usually with your feet placed in stirrups at the end of the table. This position allows your provider to access your cervix easily. If you feel uncomfortable or exposed, let your provider know. They can help you adjust your position or offer reassurance. The Pap smear itself is quick and typically only takes a few minutes. First, your provider will gently insert a speculum into your vagina. A speculum is a smooth, duckbill-shaped instrument made of plastic or metal that helps to hold the vaginal walls open so your provider can see the cervix. You may feel some pressure or a sensation of fullness, but it shouldn't be painful. Try to relax your muscles and take deep breaths. This can help minimize discomfort. Next, your provider will use a small brush or a tiny spatula to collect a sample of cells from the surface of your cervix. The sensation might feel like a light scraping or brushing, which may be a bit uncomfortable but should not be painful. If you do feel pain, let your provider know immediately. Once the sample is collected, the speculum will be gently removed, and the test is complete. Afterward, you'll have a chance to sit up and get dressed. Most women can go about their day as usual after a Pap smear. Some may experience a small amount of spotting or light bleeding, which is normal and should resolve within a day or two. If you notice heavy bleeding, severe pain, or any unusual symptoms, contact your healthcare provider. The sample collected during your Pap smear is sent to a laboratory where it is examined under a microscope for abnormal or precancerous cells. In some cases, your provider may also order a test for human papillomavirus, or HPV, at the same time as your Pap smear. HPV is a common virus that can cause changes in cervical cells and is the main cause of cervical cancer. The results from your Pap smear and any additional tests usually come back within a few days to a couple of weeks. If your results are normal, you'll be advised when to schedule your next screening. If abnormal cells are found, it doesn't necessarily mean you have cancer. Many abnormal changes resolve on their own, but your provider may recommend additional testing or follow-up to monitor your health more closely. It's important to remember that the purpose of a pap smear is to catch problems early, when they are most treatable and before they develop into something more serious. Pap smears are a vital part of preventive healthcare. They can help detect changes long before symptoms appear, giving you the best chance for effective treatment. While the idea of having a pap smear may feel intimidating, most women find the procedure to be quick and manageable. Remember, you're not alone. Millions of women undergo pap smears every year, and healthcare providers are there to support you every step of the way. If you have concerns about discomfort, previous experiences, or anything else related to the procedure, don't hesitate to talk openly with your provider. They can offer guidance, answer your questions, and work with you to make the experience as positive as possible. Taking charge of your health includes routine screenings like the pap smear. By knowing what to expect and understanding the purpose behind the test, you can approach your appointment with confidence and peace of mind. Prioritizing your well-being is one of the most important things you can do for yourself, and regular pap smears are a simple yet powerful way to do just that.